The benefit for the parents is really the cost savings there is, that they could use that money towards something else in their life that they may need that money for. So this state CHIPRA program is just really a benefit all the way around, in that it would help me sleep at night knowing that my kids have health insurance, that I'm paying very little or no money at all in some cases, to have insurance available that if something happens during the night, I can take them to any hospital and just show them my insurance card and everything will be covered. There's no financial worries of how am I going to pay for this hospital visit, how am I going to pay for an x-ray, how am I going to get that medication. I don't have that kind of money. So the CHIPRA program just alleviates all those worries from the parents.
If your child becomes ill in the middle of the night and you need to rush that child to the emergency room, you don't have to try to get transportation to go 30 miles to an Indian Health Service facility. You can go to your local urgent care or your hospital. And this has been one of the big selling points in trying to get over the barriers with parents that don't want to be part of the government insurance program, or they don't want the government to know any more business about them than necessary.
Well, to me, is because I am a single grandparent and had him since birth, it saves me not having to worry about, you know, if I take him to the emergency room, dental, anything, that it's covered, you know, and I don't have to worry about that. I can take him to the clinic, they let him right in, take him to the emergency room, which I have, dentist, any of them, and, you know, I show him the card and he's good to go, and we do what we need to do, and then he's gone.
Indian Health Service cannot answer everything that you need for your child. And if you have been fortunate to have a well family and well children, you think they can take care of everything. But you have a child that's very ill and needs heart surgery or needs some type of has a broken leg, broken arm, then you find out very quickly Indian Health Service cannot cover everything. And CHIPRA and Medicaid can take care of a lot of those issues that you will face if your child ever becomes seriously ill.
I know a lot of facilities, they depend on Indian Health Service money, and that's it, which is sad because there is other monies out there like the CHIP program, the Medicaid program, for them to access to help increase their revenues, which they could increase their services they could provide to their own patients. To this day, it still boggles my mind when I do hear facilities that don't do outreach or try to get their patients onto Medicaid, or even you know, do third-party billing, so to speak, to even Medicare or private insurance.